Hi, this is Christina at Cemetery of Choice, and I have to warn you, the content today is very graphic. Now, the images are not going to be horrendously graphic, but I will provide links so that you can see what we're talking about. It is also going to include a video illustrating with drawings how the kinds of abortions are done that cause these injuries. And we're going to look at a video today about the effect of some of these abortion injuries on hospital staff. And it's really sad that in English we've got the word injury that covers everything from a sprained wrist to having all four limbs blown off. And I think it's really important to understand when they talk about complications, this might not be some little simple thing that's easy to fix. This might be something really catastrophic. And it is not easy for hospital staff to see.
A substitute teacher from New Rochelle died last Thursday after reports say she underwent the procedure in Maryland, where late-term abortions are legal. It was performed by Dr. LeRoy Carhart, one of the few late-term abortion providers in the country.
Okay, that death is Jennifer McKenna Morbelli, and she's actually the second death linked to LeRoy Carhart. The first one, Carhart was working at George Tiller's late-term abortion clinic in Kansas, where Tiller was pretty much openly performing illegal third trimester abortions. He just would call them all health of the mother and get them rubber stamped by another doctor. In this case, the death was a intellectually disabled girl named Kristen, whose family brought her for a third trimester abortion. And the way these are done, it's a multi-day procedure, and I'm going to have Dr. Levatino here explain how they're done so that you understand a little bit better how these injuries happen.
Second trimester surgical abortion called dilatation and evacuation, or D&E. A D&E is performed between 13 and 24 weeks of pregnancy. After administering anesthesia, the abortionist uses a weighted speculum, like this one, that opens the vagina widely. Because second trimester babies are so large, this greater access facilitates a late-term abortion. Late-term abortion requires that the cervix be prepared 24 to 48 hours in advance with laminaria. Laminaria is a type of sterilized seaweed that absorbs water over 8 to 12 hours and swells to several times its original diameter. Once removed, metal dilators can be used to further open the cervix as needed.
Now, it's important to note that this takes place over multiple days. For the earlier second trimester abortions, they put the laminaria in on day 1 and do the abortion on day 2. When it gets to be later and later in the pregnancy, sometimes it's up to 4 days of swabbing out these laminaria. And these women who supposedly have health problems that require that the pregnancy be ended after the baby's viable and could be delivered alive, they spend that time not in a hospital, medically supervised, but in a motel room with just whatever friend or family member they brought with them. And they are instructed not to go to the hospital if something goes wrong. They are instructed to call the clinic. Now, from what I heard in Jennifer's case, the emergency number that her family called rang to Carhart's wife's equestrian supply business answering machine. Fat load of good that significantly delayed getting Jennifer to the hospital, and I think likely contributed to her death. Now, in the case of Kristen at George Tiller's clinic, she collapsed at the motel room. Her parents put her on a luggage rack and pushed her out to their car and brought her to the clinic. And Carhart was the one that day. And they called 911. And when the medics arrived, they didn't realize Carhart was a doctor. They thought he was a bystander because he was performing CPR so ineptly. And I've talked about it before. We see this again and again and again in abortion clinics. They don't have the proper equipment and they don't have the proper training. And when these women stop breathing or their heart stops, they're like, you know, they're like Ralph Wiggum. They're pretty much useless. So Of course, Kristen was taken to the hospital, severe brain damage, and she was taken off life support. I think Jennifer died before they even got her to the hospital. I don't recall, but it was pretty quickly.
Once the cervix has been stretched open, the suction tube is placed inside. A baby at 20 weeks gestation is as big as the length of my hand, from head to rump, not counting the legs. The suction machine is turned on, and pale yellow amniotic fluid surrounding the baby is suctioned out through the catheters. With babies this big, they don't fit through catheters this size. The baby's bones and skull are too strong to be torn apart by suction alone. This is a SOFR clamp.
Okay, and another thing that different doctors have different criteria for when they will do what's called diging the baby. Dig is short for digoxin. It's a cardiac medication that with an overdose will stop the heart. And after a certain point, these babies are tough. They are hard to take apart. And I don't know whether he got the terminology from me or whether he thought of it independently, but Carhart described this as like putting the baby in a crock pot, which I've been saying since the mid-1990s. You know, if you tried to just take a chicken apart with a pair of kitchen tongs, you're not going to get far with a raw chicken. You leave it in the crock pot long enough, it's nice and soft, and you can just pull it apart. And that's what happens at a certain point. Each doctor makes their own decision about how far into the pregnancy, generally 20 weeks or later. Some even later than that. They don't start diging until after maybe 22, 24 weeks. And so they dig the baby so that it's easier to take apart. However, if they don't dig the baby is alive. The baby is not anesthetized while this is happening. And Carhart has said that he knows the baby's still alive during the procedure because he sees the heartbeat on the ultrasound. This is how brutal this procedure is.
SOFR clamp is made of stainless steel. It's about 13 inches long.
Oh, by the way, the SOFR clamp was invented for doing abortion. It's got those heavy-duty teeth on it because these babies squirm and try to yank away, like any living creature would do if you're trying to pull its limbs off.
The business end is about 2.5 inches long and 1/2 inch wide, and there are rows of sharp teeth. This is a grasping instrument. When it gets a hold of something, it does not let go. The abortionist uses this clamp to grasp an arm or leg. Once he has a firm grip, the abortionist pulls hard in order to tear the limb from the baby's body.
He doesn't just pull, he twists. They're simplifying the illustration. Again, this is something that Carhart describes. They'll grab the limb and they'll pull down until the baby's body is tight against the inside of the woman's cervix, and that kind of holds the baby still so that they could twist and wrench that limb off. They can't just reach in and pull. And yes, abortion doctors have made jokes about how they need to work out, or they get great big biceps and forearm muscles in their right arm from the amount of strength it takes to tear these babies apart with forceps.
One by one, the rest of the limbs are removed, along with the intestines, the spine, and the heart and lungs.
Now, something can happen in these abortions that's called pulling bowel. And that's exactly what it sounds like, where they accidentally push the forceps through the back of the uterus, make a hole in the uterus, grab a loop of the woman's intestines and pull them out through her vagina. And that's how Sharon Hamplin died in California. Bruce Steer got a funny look on his face, looked at his assistant, and said, "I think I pulled bowel." And in a National Abortion Federation risk management seminar that I listened to the tape of, this one doctor, and I can't remember if it was Steer or not, talked about how he managed pulling bowel. And he said he'd just stuff it back through the hole. He would give the woman extra drugs to contract the uterus a little harder and send her, watch her a little bit more carefully in recovery and then send her home none the wiser. And the moderator for that session was Michael Burnhill, who was medical director of Planned Parenthood Federation of America. And he reamed this guy out for this. Then he asked, how many of you do this? And he counted 6 that raised their hands. This is National Abortion Federation, cream of the crop, people who care enough to spend money on this membership and then go to these seminars about risk management. Can you imagine what's happening in clinics where the doctors don't care that much? If you've got 6 people who, after this guy's reamed down, it's like, yeah, I just poke it back in and hope that nothing bad happens.
Usually the most difficult part of the procedure is extracting the baby's head, which is about the size of a large plum at 20 weeks. The head is grasped and crushed. The abortionist knows he has crushed the skull when a white substance comes out of the cervix. This was the baby's brain.
Another interesting thing I heard at a National Abortion Federation risk management seminar was an argument between Warren Hearn and Mildred Hansen about how to handle the head. Hearn insisted that you need to grasp the head and squeeze and watch for the brains to come out. He calls it Calvarium show, so that you're sure that you have grasped the fetal skull and not a part of the mother's body that you're pulling out. Hansen, on the other hand, pointed out that of all fetal tissues, fetal brain is the most likely, if it gets into the mother's bloodstream, to cause what's called disseminated intravascular coagulopathy, DIC. This is a clotting disorder. The clotting factors in the blood get all messed up. Now, in some types of DIC, the blood just clots all over the place, but in the kind that's triggered by these abortion injuries, it just stops clotting, and the woman can very quickly bleed to death from very superficial injuries. And it can be a tiny, tiny tear in the cervix caused by the bony portions of the skull. So Hansen was arguing that what you need to do is you need to get the head down close to the cervix and then suction the brain out so there's no chance of the brain getting into the maternal bloodstream. That is an argument I wish all pro-choice people had to listen to when they are supporting these abortions. Listen to this and say, yeah, that's cool. We should totally be doing this.
The abortionist then removes skull pieces. He removes the placenta and any leftover parts of the baby.
They don't always bother removing the leftover parts of the baby.
With a curette, scraping the lining of the uterus for any remaining tissue. The abortionist then collects the baby parts and reassembles them to make sure that there are 2 arms, 2 legs, and all the pieces.
Another interesting discussion I heard at a National Abortion Federation meeting is when the mother wants to see her dead baby after the procedure. And this is generally when it was done for fetal indications, like the baby had Down syndrome or something. And a lot of doctors will bully these women into abortions because they genuinely don't think that people with disabilities have lives that are worth living. So they will badger these women into aborting these wanted babies, and the mothers want a chance to say goodbye. And there's a discussion about, okay, how do we handle this? And generally the approach that they take is they reassemble the baby on a tray, and then they cover it with a cloth, and they'll like uncover the little feet so that the mother can see the feet, and they'll uncover the little hands so the mother can see the hands. And they try to encourage them to be happy with seeing just the feet and the hands and not the entire mangled remains, as you can probably imagine.
Once all the parts have been accounted for, the abortion is complete. For the woman, this procedure carries a significant risk of major complications, including perforation or laceration of the uterus or cervix, with possible damage to the bowel, bladder, and other maternal organs. Infection and hemorrhage can also occur, which can even lead to death. Future pregnancies are also at greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix. Finally, I'm going...
Okay, so now you're familiar with how these are performed, and now you're familiar with why Kristen was not, who was having this abortion for supposed maternal health reasons, was in a motel room instead of in a hospital. So we'll go back to Carhart here.
On May 12, 2020, at 3:50 p.m., the Montgomery County Fire and Rescue Service in Maryland received a 911 call. The call came from the abortion facility of abortionist LeRoy Carhart. A woman had been badly injured in the course of a late-term abortion. She was examined, given care, and transported to Shady Grove Adventist Hospital. Arriving at the emergency room, the woman was reevaluated and found to be in critical condition. The woman was rushed into the operating room for emergency surgery. She was bleeding heavily from a ruptured uterus, in shock and showing signs of sepsis. Parts of her baby had been left inside her, including a severed leg that was intact from the hip down. Some of the parts had been pushed through the uterine tear and up into the abdominal cavity. The woman's bowels were so badly damaged that the surgeon had to redirect her large intestine to an external bag. After surgery, she was sent to the intensive care unit to be monitored. One of the attending staff members described it as the most horrific thing I have ever seen.
And this is not unique to LeRoy Carhart. Shoving fetal parts through a hole in the uterus into the abdomen, the hospital staff looking at the remnants of a baby that could have been in the NICU, in the neonatal intensive care unit, being provided care, and instead is mangled and dead inside this woman's body. And the injuries, like I said, can be catastrophic. Magdalena Rodriguez in California, she had lost so much blood and it was stuck in her abdomen. And she actually popped like a water balloon when they cut her open, and it just splattered the operating room with blood. And you can imagine how traumatized the hospital staff were by that.
The attending surgeon emailed hospital staff acknowledging the trauma they may have suffered from the experience. 9 days after her near-fatal injuries, the woman was discharged from the hospital. That same day, another woman arrived by ambulance from the same abortion facility. She was in even worse condition than the first woman. The woman's uterus had been badly punctured, leaving a hole at the back about 9 inches across. The body of her baby had been shoved through the hole and into her abdominal cavity. The baby was missing an arm and part of its spinal column, but its head was still attached to its body by a small strip of flesh. The woman hemorrhaged so badly that she needed a transfusion of 4 pints of blood to keep her alive. Treatment for her gruesome injuries included an operation that permanently ended her ability to have children.
Probably a hysterectomy. That's not uncommon, and it's not uncommon for it to happen in abortion patients as young as 12. We had a case at Life Dynamics where a 12-year-old not only wound up needing a hysterectomy, but fetal tissue traveled into her brain and damaged the visual cortex, and she was left blind.
Both women suffered their injuries while undergoing D&E abortions at 25 weeks gestation.
Okay, 25 weeks gestation. Babies can survive as early as 22 weeks, and viability is routinely placed at about 24 weeks. So these are babies that are a week past the point where if the woman went into labor in a hospital, they would be expecting a live baby to take to the NICU and not a miscarried dead fetus.
At this age, preborn children are able to feel pain and can survive outside of the womb. Both abortions were committed at LeRoy Carhart's abortion business in Bethesda, Maryland.
The baby has no input in this as far as I'm concerned.
But it's interesting that you use the word baby because a lot of abortionists won't use that. They'll use the word fetus because they don't want to acknowledge that there's a life.
So I think that it is a baby, and I use it with the patients.
And you don't have a problem with killing a baby?
I have no problem if it's in the mother's uterus.
22 serious injuries and 1 patient death have been reported at Carhart's 2 abortion facilities in Maryland and Nebraska since 2012.
His clinic in Nebraska, you should see this building. It used to be a mechanic's shop. There's garage bays on the bottom floor. It's just, what is with this guy?
Operation Rescue has sent a letter of complaint to the U.S. Department of Health and Human Services demanding that Carhart be held accountable.
Good luck with that. And this guy is a member of the prestigious National Abortion Federation, and the pro-choice movement did this biographic movie about what a hero he is for providing these vital reproductive health care services to women and caring ever so much about women being able to get safe, ever so safe legal abortions. He's a hero. The pro-choice movement loves this man the way people with Trump derangement syndrome hate Trump. That's how much they love Carhart.
The abortion industry claims that abortion is safe, but every abortion brutally kills a child and harms a woman.
Okay, so like I said, I will have some links below so that you can learn more about how these abortions are done, what the remains of the baby look like, and some of the cases of women who have died from these abortions. This is something, if you are going to go around supporting pro-choice organizations, it's just like if you're walking around with a Black Lives Matter sign, wearing a Black Lives Matter t-shirt, you have a responsibility to understand what the Black Lives Matter organization and movement are really about. And if you're going to be wearing little pro-choice pins and wearing a pro-choice t-shirt and talking about how you're voting pro-choice and you're supporting pro-choice politicians, you need to be aware of what you're supporting, which is absolute adoration for this guy Carhart in spite of what he's done to these women.